Hello, thank you for joining us today. My name is Katie Flores, and I'm going to be moderating today's meeting. So if any questions come up throughout the presentation, feel free to drop those in the chat, and we'll make sure that we get to those. And now I would like to introduce Kimberly Knight. Kimberly is the Director of the Caregiver Support Program at the Senior Source.
Hi, welcome everyone. We are so grateful for you guys to be here today for our community conversations featuring our long-term care program here at the Senior Source. I have the honor of introducing you to my esteemed colleague, Susanna Sofstead. But before I do so, I just want to talk a little bit about today's program. We actually had two speakers that was going to come and bring information in this space, but our second speaker was unable to join us, and she was going to be primarily focused on licensed group homes in the Dallas area. And so we won't be able to provide you with that information today, but we will be able to talk about a lot of things under the long-term care spectrum. So I am just going to say Susanna, my colleague, is extremely knowledgeable in this area. She has been with the Senior Source for 21 years, and she has been an ombudsman for 18 of those years. And so without further ado, I'm going to turn it over to Susanna, and she is going to talk about all things long-term care. So thank you, Susanna, for joining us today.
Well, thank you, Kimberly. Good morning, everyone. I'm thrilled to have this time to be with you today to talk about long-term care. I'm going to provide information about the different types or levels of long-term care and then share some tips for navigating the process of choosing a facility for a loved one. That can be an overwhelming process, and my goal today is to give you information and tools to help make that decision a little bit easier. Before I get started with that, though, I do want to tell you just a little bit about the long-term care ombudsman program so that you know who we are and how we can be a resource if or when you enter the world of long-term care. Well, there we go. All right. So I often get funny looks when I tell people that I'm an ombudsman. It is not the easiest word, but simply put, it is a Scandinavian word that means advocate. The long-term care ombudsman program is both state and federally mandated to advocate for the quality of life and care for residents in nursing homes and assisted living facilities. Ombudsmen work to protect the health, safety, welfare, and rights of these residents, and we do so by making regular, unannounced visits to the facilities where we go room to room, talking with the residents about their care and working to resolve complaints on their behalf. Ombudsmen are independent, meaning we don't work for the facility or anyone other than the resident, and our services are confidential and free of charge. In addition to our complaint work, ombudsmen educate residents as well as facility staff on topics such as residents' rights and abuse and neglect. Ombudsmen are also a resource for people in the community who are going through that process of choosing a facility for a loved one. And while we can't recommend specific facilities, we can help narrow the list of options based on an individual's needs and provide information such as common complaints that we address at individual facilities. We can also help people access the state's most recent licensing inspection, and we'll provide materials to guide them through that process of choosing a facility, all with the goal of educating people as much as possible so that they can make the best choice for their loved one. Locally, our program is housed here at the Senior Source, and we're responsible for serving about 16,000 residents in the 82 nursing homes and 214 assisted living facilities in Dallas County. Currently, we have 8 staff and 13 certified volunteer ombudsmen in our program. Every long-term care facility in the country is served by an ombudsman program. So if an individual needs assistance with the facility outside of Dallas County, then we can get connected with the appropriate program. The final component of our program that's unique to the ombudsman program here at the Senior Source is our Friendly Visitor Project, which plays a critical role in improving the quality of life for residents in Dallas County facilities. We know that at least half of our residents never have visitors. They've been placed in these facilities and then forgotten. And so friendly visitors are individual and group volunteers who get matched one-on-one with residents in the facilities. They also help with activities and host donation drives at the holidays. Since COVID, this part of our program has evolved into more of a hybrid opportunity where volunteers can either Volunteer in person or help support residents remotely by sending them notes of encouragement and donations such as snacks, puzzles, craft supplies. Last year, we connected more than 2,900 in-person and remote friendly visitor volunteers with our long-term care residents, and all of their efforts have helped the residents know that they've not been forgotten. So that's just some of the great work that we are doing in the Ombudsman program. And at this time, I do want to transition to talking about long-term care options, since that's why we're here today. While most of us don't want to think about long-term care, it is so important that you know about the different options and where to go for information. 70% of older adults will need some type of long-term care at some point, whether that's assisted living or a short-term rehabilitation stay following surgery, or it truly is long-term care in a nursing home. Chances are that you or someone you love will need this information. When it comes to long-term care, there are a lot of options. Senior living comes in many shapes and sizes, and there is no universal setting or approach to care that works for everyone. That really makes doing the research so important, so that you find the right option that works for you and your loved one. So what exactly are those options? They're going to include independent living, assisted living, skilled nursing, and continuing care retirement communities. I'm going to take a little time to describe each of those, just so that you have an understanding of the types of services and care that each provides. We'll start with independent living, and while it technically is not considered long-term care, it is another alternative living arrangement for older adults, and I think it warrants being mentioned. You might hear independent living also referred to as a retirement community or active 55 plus community. It's primarily an apartment-like setting geared towards seniors. Typically, there's going to be a minimum age requirement that's set by each community. And independent living is designed for seniors who are still able to live on their own, but they don't want the responsibility of home ownership any longer. In addition to the housing piece, many independent living communities offer additional services such as meals, laundry, social activities, and transportation. But that does vary from community to community, and there usually is going to be an extra charge for those services. Prices for independent living can vary anywhere from $825 a month for low-income housing up to $5,000 or more a month. It's very important to ask a lot of questions up front to know what's included in that monthly rent, as well as what the cost will be for any additional services. I also do want to note that independent living communities are not licensed or regulated by any outside agencies, and there's not an ombudsman available to address concerns in those communities. Assisted living is going to be the next step up, and it is the fastest growing sector of senior housing in the US, primarily because it's viewed as a less costly and less restrictive alternative to nursing homes. Assisted living provides personalized care in a residential setting, and it's designed for individuals who need some assistance with their activities of daily living, such as medication management, bathing, and grooming, but they don't need 24-hour skilled nursing care. In addition to those personalized support services, assisted livings provide housekeeping, meals, laundry, and transportation, as well as social programs and activities. Assisted living facilities are required to be licensed and regulated by the Texas Health and Human Services Commission. That's the state agency that provides oversight of these facilities. And assisted livings are served by the Ombudsman program. So some key areas to know about with assisted livings are the licensure type, the setting, how they're staffed, and then how to pay for that care. In Texas, there are two main types of assisted living, type A and type B, and the licensure is based on the resident's ability to evacuate the building in an emergency and whether or not they require assistance at night. It's important for people to know about the different types, because an individual might be appropriate for one type of assisted living, but not the other. In a type A facility, residents are still fairly independent. They must be able to get themselves out of the building in an emergency, such as a fire, without requiring help from the facility staff. And then they also cannot require help during the nighttime sleeping hours. So somebody who needs help transitioning from a wheelchair to the bed, or who's incontinent at night and needs help getting cleaned up at night would not be appropriate for a type A facility. In a type B facility, though, we do have residents with heavier care needs. Residents can require more assistance, including that help getting out of the building in an emergency as well as at night. Some of our type B facilities are actually Alzheimer's certified. So an assisted living type B, assisted living can be a viable option for individuals who have dementia and need a memory care setting, depending on their individual needs. In terms of the environment, there is quite a bit of variance. Some assisted livings are small personal care homes that are designed to provide care for anywhere between 4 and 16 residents. They look like any other home in the neighborhood, but they've been converted and licensed for assisted living care. In that setting, residents will have a bedroom and possibly their own private bathroom, depending on the facility, and then they'll share all of the other common areas. On the other end of the spectrum, we have much larger apartment-like facilities where the resident has a bedroom with a private bathroom and sometimes a small kitchen. Typically, when it comes to staffing, there's not going to be as much staff in assisted living as what we see in our nursing homes, especially during the night and on weekends. Our small assisted livings may only have 1 or 2 staff on duty. And in these small assisted livings, the staff are going to be wearing multiple hats, where you have the same person who's helping to bathe a resident, helping to prepare their meals, and then do their laundry. In our larger assisted living facilities, you will see more staff, and they may have a nurse either on duty during the day or have one on call, but they may not have one in the building 24/7. And then finally, when it comes to paying for care, as I said earlier, assisted living is often a lower cost option. The average monthly cost in the Dallas area is $4,195, with costs varying on the services provided and the level of care that the individual needs. We have a handful of homes that will charge in the low 2000s, and then some that charge as much as $10,000 a month. As with the independent living, it is very important to read the admission agreement because that will spell out exactly what's included in the monthly rate, as well as what extra charges will be assigned when an individual's level of care needs change. The admission agreement is a contract between the resident and the facility. And so again, it's just really important to read that so that you know what the facility is going to be required to provide and what you can expect. Options for paying for assisted living are going to include private pay, long-term care insurance, veterans benefits, or a Medicaid waiver. Medicare will not pay for assisted living. All right, next we have skilled nursing facilities or nursing homes. While assisted livings are more of a residential setting, our nursing homes are going to be more of a medical setting. And I think for a lot of people, they are what come to mind when you hear the term long-term care. Nursing homes are generally designed for people who have more complex healthcare conditions that leave them unable to care for themselves. They provide 24-hour skilled nursing care, as well as meals, activities, and help with dressing, bathing, going to the bathroom, and medications. In addition, they're going to have staff on site who provide physical, occupational, and speech therapy. When it comes to those activities of daily living, individuals usually require assistance in at least 2 areas, but some may require total care. For many people, it is going to be a permanent move to the nursing home, but others will be there for a short-term rehabilitation stay following a hospitalization for a serious illness or surgery, and then still others may be there for a respite stay before returning home with family. Like assisted livings, nursing homes are licensed and regulated by the Texas Health and Human Services Commission, and they are served by the Ombudsman program. So some key areas to know about nursing homes are the setting, how they're staffed, and again, how to pay for them. In terms of the environment, nursing homes traditionally have had more of a hospital-like setting and been more institutional without the long hallways and the centralized nurses station. Thankfully, we are starting to see some changes as new nursing homes are being built and older ones are being renovated. But I always caution people to be mindful of the chandelier effect. Just because a facility is new and beautiful, it doesn't necessarily mean good care. So you still need to do your research. New facilities often have to work through issues when they first open. In terms of staffing, there are more staff in nursing homes. They are required to have one licensed nurse for every 20 residents in a 24-hour period. But currently, there is no minimum staffing ratio for the certified nurse aides or CNAs, and those are the ones who are providing that direct care, such as bathing the resident or helping them get to the bathroom. So that is an important question to ask as you start looking at facilities, is how many residents are assigned to each aide or each nurse? And then also, will the same aides be consistently assigned to your loved one during each shift? That is considered a best practice in care. And then in terms of paying for the care, some nursing homes are private pay and others are certified for Medicaid. The average monthly cost is going to range anywhere from $5,600 a month for a semi-private room up to $8,400 a month for a private room, plus the cost of prescriptions. But those costs can range as high as $12,000 or more in some facilities. And then the payment options are going to include private pay, long-term care insurance, and you definitely want to make sure you read the fine print because there's a lot of different policies out there and they have different requirements in terms of the types of facilities they'll pay for. And then Medicaid for individuals who fall below a certain income and asset threshold. And Medicare will pay for that short-term rehab stay. Finally, there are continuing care retirement communities or CCRCs, which offer independent living, assisted living, memory care, and skilled nursing all within the same community. The chief benefit of CCRCs is that they provide that wide range of care, services, and activities in one place, which really offers residents a sense of stability and familiarity as their abilities or health conditions change. A resident can start out living independently in an apartment and then later transition to assisted living to get more help with daily activities or to skilled nursing or memory care or to receive more medical care while remaining in the same community. I think CCRCs also offer a benefit for couples when one individual has heavier care needs than the other because they allow the couple to remain in the same community, though perhaps in different care settings. With CCRCs, it is important to note that if an individual enters at the independent living level, they typically will pay some type of entry or buy-in fee and then a monthly maintenance or service fee. In most cases, that upfront deposit is partially refundable to you or to your state when you move out. So that gives you a good overview of long-term care and the different options available. It's never too early to start doing research and making plans. Placing a loved one in a nursing home or assisted living facility can be one of the hardest tasks that a family member ever faces. And so the more you can plan ahead, the more you can discuss preferences with your loved one and involve him or her in the decision, the easier that decision and arrangements will be if or when the need for long-term care arises. So as you start your search, talk to people. Obviously, the most important person to talk to is the prospective resident. If your loved one is able to express his or her wishes, include them in the process and ask what their preferences are. Talk with your physician. He or she will be able to help you know when it's the right time for long-term care and which type of setting is going to be the most appropriate. Also, poll your friends, your neighbors, people at church, ask about their experiences with different facilities, and then call the Ombudsman program. As I mentioned earlier, we have materials that we can send to you that will guide you through that process. They're going to include questions to ask, things to consider when looking at facilities. Before making a decision, you definitely want to visit multiple facilities so that you have a comparison and don't rely on just the initial tour. While it is a good way to gather basic information and narrow your choices, one tour typically isn't going to be enough. As much as possible, you want to visit a facility more than once and vary the times when you're visiting, perhaps during a weekday and then again in the evening or on the weekend, so that you have a better picture of what life really looks like in that facility and how they're staffed. When you're visiting, talk with residents who live in the facility as well as their family members and ask about their experience living there. During your visit, engage your senses. Do you notice any odors? Do residents seem engaged and active, or are they in wheelchairs lined up against the wall? Do you hear call bells going off unanswered? Do you see staff interacting with the residents? You can learn a lot about a facility just through your own observations. Also, consider how far a facility is from family and friends and how easy it will be for them to visit. As you're narrowing your search, reach out to us again. We can talk about common complaints that we address in individual facilities and help you find and interpret information from state inspection reports, including any deficiencies a home has received. And when looking at those reports, you want to pay particular attention to any citations related to infection control, as well as substandard care and abuse and neglect. If you want to review the inspection reports yourself, you can find them along with facility ratings on that first website that I have listed here, which is the Medicare website. But please note, it's only going to have information about nursing homes. When looking at that website, the Care Compare one, I always tell people to take the rating itself with a grain of salt because they do have a 5-star rating system on there. Much of what's of that score or that rating is based on information that is provided by the facility and has been self-reported. So it's pretty subjective, but outside of the rating, there is a lot of helpful information on that website, including those inspection reports that I had mentioned that are going to detail any deficiencies that have been cited in a facility. The second website that I have listed is for the Texas Health and Human Services Commission, which again is that state agency that licenses and regulates nursing homes and assisted living facilities. So you'll be able to find on that website, you'll be able to find information about the inspection reports for both types of facilities, but the information is not going to be quite as detailed as what's provided on the Medicare one. And then this final website that I have listed is for the Consumer Voice, which is a national organization that educates the public on long-term care issues, and it serves as a voice for consumers in those settings. This website has a wealth of information about long-term care for residents and families, and it really is a go-to resource for us as ombudsmen. And then finally, once your loved one has moved into a nursing home or assisted living facility, there are some ways to help improve the care that they receive. Most important, visit. Encourage extended family, friends, church members to visit as well. Residents who have frequent visitors tend to receive better care, and so it's so important to get out there. You'll need to comply with the facility screening procedures. You may be required to wear a face mask right now, depending on the facility, and of course, should not visit if you have COVID-19 or have symptoms. But as long as you're not sick, you should be allowed in to visit. You want to participate in the life of the facility by attending activities with your loved one. If a family council exists at the facility, join it. That is a great way to meet other family members, and it can often be a good source of support for you. Make it a priority to attend your loved one's care plan meetings, which are held quarterly, so that you can be informed about what the facility staff are doing to meet the residents' needs. And then one final plug for my program, get to know the ombudsman for the facility. We are a resource for the resident as well as families, and we're ready to assist if you do have concerns with care or anything else related to the stay there at the facility. And then, of course, if you have concerns at the facility, you always have a right to file a formal complaint with the Texas Health and Human Services Commission as well. All right, so that's who we are. Those are the options as far as long-term care goes. And so at this time, I guess I will turn it over to Kimberly or see if we have any questions.
Any questions? I don't see any in the chat yet, but feel free to unmute yourself if you do have a question or comment. Looks like you covered it all.
All right. Well, I've got my contact information up there. So if anybody thinks of questions later on, please don't hesitate to reach out.
I'm
Thank
going
you
to drop
so much.
I'm sorry. Oops. Sorry, Kimberly. I'm going to drop a couple things in the chat. Just more information and documents if you want to grab those. And then Kimberly has some things to share.
All right. Thank you so much, Susanna, for such a comprehensive presentation on long-term care. I mean, it's a topic that we get questions all the time through caregiver support, and it's something until you are having to, I think, navigate just the different options that are out there, the different communities, it can be really confusing, and often families don't quite know what to do or even the questions to ask. So thank you so much for your presentation. I just want to share a little bit about caregiver support program itself, and then two, just to say a little bit about group homes. So I am going to share my screen really quickly. All right. So the thing I just want to say in regards to a group home is that it's just another option that's out there. All group homes are not created equal. That's the thing I want to say the most in this space, because there are some group homes out there that are not necessarily licensed or regulated, but there are some out there that are. And so Katie just dropped in the chat a list for Dallas County, the city of Dallas, of licensed boarding homes that exist. The group home model is something that's been around for a while, and it's a residence model of medical care for those with complex health needs. Traditionally, the model has been used for children or young people who cannot live with their families or afford their own homes, people with chronic disabilities who may be, adults or seniors, or people with dementia and related age illnesses. And so, again, at a later date, we will probably reschedule the presentations about group homes, but we did at least want to address the fact that group homes do exist, that there are some that are licensed and they are regulated, meaning that there is an agency, and this is the city of Dallas, that comes in and regulates those homes. So they have standards that they have to meet. Some group homes often, when you hear about them, they get a really bad rap. And it's because, sometimes when things aren't regulated, it can go awry. But for those that are out there that are licensed, that are meeting standards, they are worth looking at and could really be an option for long-term care. So I just wanted to say that. And of course, when we reschedule that presentation, we will email you all and let you know the date and time so you can hear directly from the expert about group homes that are out there. So just to talk a little bit about caregiver support, our program goal is to provide resources and support to individuals and families so that they feel confident in their role as a caregiver. Also, we're here to remind caregivers to take care of themselves and to put on their oxygen mask first. And I'm sure you've heard that analogy millions of times, but it is really, truly the best analogy, because when you're on an airplane and if it loses altitude, if you don't put on your oxygen mask first and you go to assist the other person, by the time you get to yourself, you could have passed out. And so it's the same with caregiving. You can't be a caregiver to someone else if you aren't taking care of yourself. So we're here to remind you to not lose focus on you, but to take care of your own mental, physical, and emotional well-being throughout this process so that you can continue to be there for your loved one. Through our caregiver support program, we provide resources in various areas. One in which you experience today, we provide education to the community. We ourselves put on presentations on various topics surrounding caregiving, but we also bring in experts in the field to talk about different things that caregivers need to know, such as long-term care. It could be end of life, palliative care, hospice, just you name it, just the subjects go on, but we bring in those types of things, as well as we have some classes that are focused on just reducing stress, taking care of yourself through nutrition. We have a cooking demonstration, but we have lots of offerings we do through education, and we do them on a virtual platform like Zoom. In addition to that, we also provide a care consultation. Care consultations are when you have the opportunity to talk to our team one-on-one, and we listen to you about your caregiving journey, and then we help identify what your needs are and help you to put together a care plan. Oftentimes caregivers are kind of just thrust into this role and have not necessarily planned what to do and how to do it. And sometimes it's just that they just need that little guidance to show them what to tackle first, second, and third. And so we're here to do those types of things through our care consultations. We also provide referral services to community or the other community organizations that are out there that may have other specialties that we don't cover here at the Senior Source. So for instance, if you are needing a wheelchair ramp built or you need grab bars installed, we can refer you to community organizations that's their expertise, and they'd be more than happy to assist you. In addition to that, we also have support groups that we offer to caregivers. Support groups can be a great wealth of knowledge and just a place to come together to receive support from other people that are going through a similar situation. I would say members of support groups, they never cease to amaze me. They're so giving as far as tools and tips of what's worked for them. Even doctors that they visited and they, had good experiences. You can just get all sorts of tips and tricks, I think, as a caregiver through talking to other caregivers. And so one way to do that is through a support group, and also reduce your own personal emotional stress that you are experiencing as a caregiver. In addition to that, we also offer free incontinence supplies. So if you have a loved one that is in need of incontinence supplies, or you yourself as a caregiver is in need of incontinence supplies, you do not have to income qualify, but we do provide them as long as we have supplies within our caregiver closet. So those are all of the services that we offer through the Caregiver Support Program. Out of the 2,100 people that we served in our program last year, 84% reported experiencing less caregiver-related stress after partaking in one of our services. So that's a fact we're very proud of, and we encourage you to check us out in other areas. With you being here today for an education class, consider joining a support group or signing up for an additional class, as we have them on our calendar on the Senior Source website. And this is how you contact us. Our phone number is 214-853-5700, or you can also contact us at csp@theseniorsource.org. And here are all the services that are offered at the Senior Source. We have the Elder Financial Safety Center, where they can help with Medicare, Medicaid questions, also frauds and scams, and even employment for seniors. We have our guardianship program. These are court-appointed caregivers that step in when there aren't family members to help out with the caregiving responsibilities, or even sometimes there could be family, but there's just not agreement. There's fighting, and the person who's suffering from that is the care recipient. So guardians can step in, but again, they are court appointed. You just heard from Susanna, who's a part of our long-term care ombudsman program here. And then we have volunteer opportunities for seniors. If you are an older adult and you are just wanting to stay active and just lend your expertise to other people in our community, well, we have ways you can plug in through our RSVP program, foster grandparents, and our senior companion program here at the Senior Source. So those are all the ways we can help you here. Again, you can reach us through 214-853-5700. You can email us directly at csp@theseniorsource.org, or you can just log on to our website, which is theseniorsource.org. So thank you. And are there any questions? All
I
right.
think you covered it very well today.
Okay. Well, thank you so much for joining us. It was our pleasure to be here with you today. I'm going to turn it over to Katie, because I know there's something she's probably going to add that I have forgotten.
Actually, no, you covered it all. And I did put the contact info in the chat if you didn't have time to write that down. So you can copy and paste that where you need it. But thanks again for joining us. I hope that was helpful.
Yeah. And when you log off, I think there's going to be a survey that pops up. No?
No, not today.
All right. Well, no survey. All right. Thank you so much. And we'll see you next time.
Thank you. Bye.